accumulate them over a lifetime. And some people just tend to accumulate them in their body, and they don't get rid of them very easily. Another aspect of these toxic metals, particularly lead, is that it decreases cognitive function. Alzheimer's, pre-Alzheimer's, things that are called Alzheimer's, you lose your mental, not only your memory, but your ability to reason a little bit. You want to try to minimize exposure, but if you take chelation therapy of various kinds, and sometimes you can use oral products, sometimes you have to use intravenous products, but you can pull these toxic metals out of your system. And it can make a huge difference in your circulation all over your body and how you feel, and it reduces inflammation too. And inflammation leads to cancer, sometimes arthritis, chronic degenerative diseases. Toxicity is a significant problem that must be addressed. And ignoring toxic factors greatly limits our ability not only to prevent illness, but to heal things. And most doctors, I mean, everybody knows that these toxic metals are around. It's all over our newspapers. But where do you hear a doctor talking about it in his office, you know, or what to do about it? But there are answers. It's just we haven't got to it. Another problem is mercury. Mercury is the second most toxic metal behind radioactive substances. And that's in our teeth, in our amalgam fillings. It's also in the burning of coal for our power plants. Mercury is emitted. And it's in fish in the ocean. You eat fish and you reduce your risk of heart attacks, and yet fish contain mercury and PBBs. Well, mercury does in the fish, and for some people it really does, it is a problem. And if you have high mercury, you have to be careful about that. But the fish contain an oil that is very beneficial for you, and that oil has more benefit than the toxic effect for most people. So if you don't go overboard and you eat fish maybe 2 or 3 times a week, most people are going to have more benefit than they're going to have risk. So are the foods we're eating, are they poisoning us? Well, maybe in a little way. Certainly if they have too many pesticides, too high a level of metals, trans fatty acids, too many carbs, allergies, all those things can be deleterious to our health. So you want to eat as healthy as we can. We have to be careful about our food. And one of the most striking things that some of our patients say, I can't believe that foods were doing that to me, until they got on a diet that was a healthy diet and they felt so much better. Now this is a study I promised I was going to tell you about. We published this study. There were 8 centers, and we were the chief center, and Betsy back there, wave your hand, Betsy, was the coordinator of bringing the data together. We had 220 patients that had received chelation therapy. Now, what we were doing is we wanted to find out how many of those patients had cardiac events in the 3-year period after they received chelation therapy. And we compared that to similar groups from the medical literature. And we were actually helped by the head statistician at the Department of Biostatistics at the University of Cincinnati. And he went through and examined all these studies to predict what we would expect from our 220 patients. Well, he predicted that out of our 220 patients, if they had not received chelation therapy, there would be 15 heart attacks, 6 deaths, 31 angioplasties, and 16 new bypasses. Well, as it turned out, when we looked at our patients, our treatment group had no heart attacks and no deaths. Remember, they were supposed to have 15 heart attacks and 6 deaths. They were supposed to have 31 angioplasties. We had 2. And they're supposed to have 16 bypass procedures, and we had 6 in that 3-year follow-up. So chelation therapy was very effective in reducing these cardiac events, including reducing deaths from heart disease. And remember, the drugs and surgeries improve symptoms, but they don't improve deaths. Now, there's a big study going on right now called the TAC trial, Trial to Assess Chelation Therapy. It's a big double-blind study nationwide. We're participating in that study. It has pretty much the same endpoints that our study did, but it's much bigger. It's almost 2,000 patients, and it's double-blind, so it's the type of research that they really want for acceptance of a new therapy. So we're hopeful that chelation therapy will be accepted as a result of that study. We still are accepting new patients. So if anybody knows anybody who's had a heart attack, they have to have had a heart attack, and they have to be at least 50 years of age. And if they're interested in being in the study, they may get the chelation, they may not, but the whole thing's free, you know. And so it's a very good study. And if you know anybody that might be still interested, we're still enrolling patients. We've so far nationwide, I think we've enrolled about 1,200 patients, and we have about 1,950 in the study. So pass the word if you know anybody that's had a heart attack. Imbalances. This is another aspect of interaction with the environment, and it's a real strong factor for integrative medicine. These are caused by activities of daily living, lifestyle stressors, interaction with the environments of various ways. When these factors are treated and brought back into balance, they can have a major preventive or curative effect if there's an illness already in progress. The first one I'm sure you've all heard of, and that's manipulation. With the chiropractic or osteopathic manipulation, also massage therapy can be very useful in bringing the structure of the body back into balance. Now, we don't do that. I'm an MD, so I'm not qualified to do manipulation, but I work with a lot of chiropractors and osteopaths. Acupuncture and acupressure, these involve meridians of the body, and they get out of balance. And the needle or the pressure can bring that back into balance. Can be very helpful. Bioelectric techniques. There's lasers, there's magnetic therapy. There's a technique that was developed in Germany called neural therapy, and that's where you inject in areas that have these bioelectrical fields. And this is kind of the future of medicine, but it can be very helpful. We're just beginning to learn about it. It can be very helpful in bringing back people back into balance. Homeopathics, that's one of the mechanisms of homeopathic medicine. Bioidentical hormones, you may have heard of that. The synthetic hormones have been really cut back because they've been proven